Okay, I'm aware we're short on time and we want to spend a good amount of time on the group work to get people's views from the tables. So we will try and keep this brief but necessarily detailed. So Kate and I have been working around the integrated agenda, and it's been spoken about throughout the day, hasn't it, about how important it is to parents, how important it is to frontline workers to ensure that professionals are working to one another, that people aren't having to tell their story numerous amounts of times, and that we really get the best out of a service, out of the frontline service that's out there. So it's about how we move forward as a local authority to do that. And of course we understand that integrated services on the ground work well, but where there's been reduction in funding, it seems that that isn't always working as well as we'd like it to. So what we're looking at is integration from within. And we've had a very good opportunity with the money from health moving into the local authority to pay for health visitors, which means we can potentially align and pool resources so that we can then commission services that are integrated. So it's not just saying to services out there, you need to work together. It's actually within their contractual terms saying we want a multi-professional approach, and so information which will be shared easily, etc. So that's what we're working towards. Obviously the timescales have already been set out, but that's kind of the direction that we're going in. Now, there's something to be said about language.
Do you want me to do that?
Yeah. Just insofar as the different language we use and the common language that we use with regard to prevention. So obviously prevention are those universal services, and by prevention we mean true prevention. We mean actually working with families before they experience problems in the first place, and so before there are any signs of any difficulties. And then early intervention, obviously, is that targeted help that can support where we are identifying specific issues. For example, with the Henry project, where we might have identified weight issues, and there's a programme that can be used there. So you can see the little P banks, and that's kind of how we're working at the moment. We have numerous commissioners working to commission or numerous funding strands all kind of coming together and buying different types of services, and then we're expecting all those services to kind of work together. And whilst it might take a long time to bring and align budgets together, that is the aspiration, and we know we can do that with health visitors and children's centres, so that's got to be our starting point. So there's family support workers across all tiers, and we need to be mindful of that. And there's also that strong recognition that Sophie talked about earlier on, about we're holding cases lower down. So there's lots going on amongst all of these services, but surely we've got to align them in a better way to make sure that we've got the synergy, to make sure the services are effective as they can be for parents and young people out there. So there's a little bit to be said about this. I don't know how familiar people are with this windscreen, but it's very much like somebody else put up earlier about the tiers. So there's different tiers within our system. We've got the universal services at the very bottom. Most people and young people would access those services. That's like your health visitor, etc. But when there's additional needs, we move up through the other services. So your targeted services would come in at tier 2, more complex needs would be worked at tier 3, and that's where you'd see social work, and finally tier 4, where children may not be able to live in their own families. So you can see how, when we talk about family centres and health visitors, where the work goes on, and we've got to appreciate that that's part of a whole spectrum of ensuring that we have strong families, strong communities, to keep young people at lower end, and children and young people at the lower end, so we're working with them there, and they're not escalating up into the higher tariff services. So I'll pass you on to Kate, who's going to talk you through the additional slides.
Thanks. So this is the condensed version of what we want to get to, and the first phase really. The slide before showed you the different piggy banks, and we want to start looking at how we can bring those together. What's fundamental really is that we align the services together where we can, but that they closely work with other services that we can't yet commission jointly. So community midwifery being a really good example of that, and then other services such as housing, speech and language. It's really important that all of these services do work together in order for us to achieve good outcomes for children and young people. So you've already seen this slide, but I just wanted to reiterate the top points really, because we looked at the County Council ambitions and behaviours that we want to operate as a local authority and translated those into what they're going to mean for the integrated service specification. So it is about doing what we say and having a very well and clear communicated offer that universal and early help services support people with finding their own solutions, that we're able to move with purpose and energy so that we can seize that window of opportunity with families as early as possible, that we build strong working relationships, not just with our partners, but also with our communities. The solutions that we deliver must be evidence-based and that they must be delivered to meet evidence need, and that we need to have a flexible, adaptable workforce that strives to improve and models behaviours that we want our families to have, which is for them to strive to improve. You've seen this slide, and this is going to sound a little bit like the Remain campaign, but this is the kind of opposite, really. So we've got individual services, and it is easier to budget for an individual service. It is easier to manage it. It is easier for it to have responsibility. But we've got less money, so it is time now for us to throw our checkbooks in the middle, and we know that we can achieve better outcomes if we work from within to integrate services. We know it's what we want, we know it's what you want, and we know it's what parents and carers want. So this really is for us now to start making this happen. And then finally, just to put this into a bit of context in terms of the timeline, we've been through April 16 really covers all of the governance, and everybody hates that word, but unfortunately we do have to have it. So we've been through a process of getting authorisation for our ambition to undertake this work. We are now entering into the top at the box, July. We're a couple of days early, which is great news. So we're looking at building the service specification. And this is the group work that you're going to be starting shortly is really about trying to take in everything you've heard this morning and think about, when it comes to designing these services, what is really, really important? What do we need to make sure that we're taking forward? It's a long journey really, and we started it last year with Smart Start. We've got to the point now where we want to write the spec. We will have to go through all of the legal requirements around procurement and tendering. The contract start date is the 1st of October 2017, but that is another thing to get past before the really hard work begins. So it is a very long journey, but hopefully you've seen today that we're working together with everybody to try and get to those outcomes.